Good morning. Happy Valentine's Day and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing well on Valentine's Day here. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines, answering a viewer-submitted question, and looking into our lone U.S. COVID statistic through today, February 14th. We invite you to submit any questions or suggested topics down below or via any of our listed social media. Starting with that COVID statistic, average COVID deaths per day in the last reported week were 117. In 2024, the same week, we saw 337 daily COVID deaths. Dr. Murphy, your reactions to those numbers and COVID in the country?
Well, it's obviously better than last year, so that's good. But it's still over 100 people a day dying of COVID. I mean, that's a lot. And we were down below 50 cases just a few weeks ago. And so this is the result of the winter surge in respiratory infections. So it's expected that this number would increase because when you get infected, you get exposed, get infected, maybe takes a week or so, then you get sicker, get pneumonia. It takes weeks to end up in the hospital, the ICU, and if you're unfortunate enough to pass away from this disease. So it comes later in the seasonal pandemic. So we will expect to see these numbers, and then as the cases go down, this mortality rate will also start to drop. But after the case rates actually go down. So right now we're just kind of in the middle of this whole thing, and there's a lot of it going on, this flu and RSV.
And while we may have some COVID fatigue, and a lot of people are having vaccine fatigue, there was a really great study published about the efficacy of the COVID vaccine over the last respiratory season. Could you tell us about that data?
Yeah, well, people get tired of the vaccines, but the vaccines work. And we have the tools to actually measure how effective they are. Data are data. This is reality. So in a published finding recently, reputable journal, good investigators, they have projected that the COVID vaccination campaigns have resulted this year in a prevention of 5,000 deaths in a hospital, 13,000 ICU admissions, and 68,000 hospitalizations just in the last 7 months. So this is a tremendous benefit. That's a lot of sick people. 13,000 ICU cases, 5,000 deaths, 68,000 people in hospitals. That's a lot. And so it just shows you, that these vaccines are still quite effective.
And while we're in the middle of this respiratory season, there have been some alarming flu numbers popping up. Can you tell us about that flu data as well?
Well, every dozen years or so, there are big spikes in flu cases, and this is one of those years. So flu season is the most intense since 15 years ago, actually in 2009, 2010, when there was a swine flu pandemic. So we're having just a really, really bad flu year. Now, remember, flu can affect anybody, and it can kill anybody, but especially vulnerable people, older people, people with underlying diseases, and children. In the last week alone, there were 10 pediatric deaths. And the total number of pediatric deaths for the season now is up to 57. It's estimated there have been 24 million flu cases, 310,000 hospitalizations for flu, and overall, all ages, 13,000 flu deaths. And a lot of this is due to the fact that less than half of the people, actually about 45%, of adults and children take the flu vaccine. Now, the flu vaccine is recommended for everybody down to 6 months. And it's not being utilized enough. That would bring those numbers down, of course. There's so many cases now that several school districts around the country have had to actually close the schools because there's so many sick teachers and students. In the Godly Independent School District in Fort Worth, Texas, the 3,200 student system, they had to close for 3 days recently because so many people were sick, and they basically, the school couldn't function. So it's a bad flu year. It's not too
Bad
late
flu
to get a
year? Yeah.
vaccine. It's we're about halfway through the season, but and there is a treatment if you do get infected, and there are easy ways to test oneself.
Mhm. Like you said, that flu vaccine is still available. You can still get it to protect yourself and those around you. Now, sticking with the flu, but switching gears to the avian flu, we had a
Mhm.
submitted question this week from a longtime viewer who feeds the birds around them, and they said that they haven't seen any dead or infected birds in their area. However, their partner, when feeding the birds in feeders, will use nitrile gloves. Should they stop doing that?
They're probably not at risk if they have not been seeing dead birds in the area. I think if they start seeing dead birds in the area, they shouldn't go near the bird feeder. They can also disinfect the bird feeders. That may help the birds spreading avian flu between each other. But you've got to be careful now and use some common sense. So, it sounds like this common sense approach. This is most likely okay.
Mhm. And while we're on avian flu, we had some crazy reports out of New York about the avian flu and live poultry there, as well as some shocking news regarding veterinarians testing positive for the avian flu. Can you break that all down for us?
Yeah, so in New York City, there are live poultry markets, which I didn't realize. And they found in some of the markets that some of the chickens had avian flu, and they had to be culled. Now, other poultry markets that didn't have any sick ones were told that they had to close anyway and sell off the remaining poultry within 3 days and clean and disinfect everything. And so that's going on in New York City. Then there was a study done in Ohio among veterinarians who had traveled to a meeting, and they were from all over the United States and Canada. And they did testing specifically for avian flu. And they found that 3 of the 150 were positive. Now, none of them had ever been sick. They had detailed questionnaires about, have you had any respiratory illness or anything like that, conjunctivitis, and none of them had been sick. And they were from all over the place. And some had been exposed or had worked in areas where there was avian flu. Some of them had not had any such exposure. So it was really a mix. It's only 3, but it was a mixed bag. So what does this tell us? So this tells us in a scientific study that there is a risk of getting avian flu and not even knowing that you have it. So you could be an asymptomatic carrier of avian flu. So this is actually a very important study. You see, we haven't been testing very much for avian flu. There's not a regular test for avian flu. The state health departments typically can do it. Now, some of the commercial laboratories can do it. They can subtype. The CDC recommends everybody who tests positive for influenza A, there's A and B, and it's mostly right now A. Everybody that's positive for A should be subtyped to see if it's avian flu. That just started a couple of weeks ago. So we haven't been looking rigorously. And so this is one of the first studies that really looked, really hard at a group of high-risk people, veterinarians, that are dealing with animals. And we don't even know, we know avian flu affects cattle. We know that cats can get it. But we don't know about, how much that is, and does everybody get sick? And so at least this is a step in the right direction. It's important to note that, it can be asymptomatic people around animals. And no one knows how these three got infected. So it's a start. And I think what we'll see is there'll be more and more of this kind of testing. And the more you look, the more you're going to find.
It's a really great basis for further investigation.
Mm-hmm.
However, there is another huge outbreak, not huge, I should say. It is important to know that there is another measles outbreak occurring in the United States right now, mostly centered in Texas, but can you bring us up to speed?
Yeah, there's been measles cases pretty much all over the place. Texas, Alaska, Georgia, New York City, Rhode Island. There's a pretty big outbreak with 24 active cases right now in Texas, in Gaines County, which is kind of well known for people not taking vaccines. 17.5% of children going to school have opted out of the vaccine program. And we know measles is the most contagious disease known to man. And if you don't have herd immunity, well over 90%, some say 93%, that you put the population at risk. So, this is what's going to happen if the measles vaccination rate drops below 90%, like it did there. There's going to be more and more and more of these outbreaks. People have to realize that measles is a very nasty infection. It can result in hospitalization, and it can result in death. About 1 in 1,000 children will die from measles that get it. So it's so contagious that, if this spreads everywhere, like basically all the unvaccinated children in those areas are going to get measles, and 1 in 1,000 is going to die. That's what it boils down to. So it's just a race. In 2000, when most kids were vaccinated, there were no cases in the United States. None. They thought, oh, we're going to eradicate measles and we'll work on the rest of the world. And, that didn't happen. It didn't work. And the vaccination rate dropped, and the cases are all over the place now.
And another illness where vaccination has dropped and illnesses are rising is whooping cough, or pertussis. There are some new numbers about the number of cases we're seeing thus far. Can you bring us up to speed?
Yeah, it's there's probably 15 deaths so far this year from whooping cough. And that's higher than it's been in other years. And Florida has reported more than any other state, with 44 confirmed infections, and it's really all over the place. So it generally does not cause death, but it can, as you see here, especially in very young kids. So it's just something to be aware of that's out there.
And as we look at the US's involvement internationally and all over the globe in global health, there are some sobering and startling figures that are starting to be estimated about the US abandoning USAID and potentially PEPFAR as well, which is to save people around the world from HIV and AIDS. Can you break down those findings?
Well, the abrupt closure of, three things have happened very quickly in the last couple of weeks. Pulling out of the WHO, the basically dissolution of USAID, United States Agency for International Development, and PEPFAR, the President's Emergency Plan for AIDS Relief, which was started by George W. Bush and had huge bipartisan support for many years and have saved many millions of lives. Some people say 25 million lives. 200,000 people a day are picking up medication from PEPFAR to treat this life-threatening infection. And that all has just basically come to a halt. Now, the US is the biggest player out there in treating HIV in the world. It's impossible for other agencies to actually fill that gap. They may never be able to fill the gap. It's such a big chunk of treating people with HIV. It's really going to be devastating. Right in the middle of the treatment, it just stopped. If you have to take these medicines every day, or the HIV comes back and you get sick and you can die, or you can transmit it to your child. And remember, in Africa, it's predominantly a woman's disease. It's 2/3 women, 1/3 men, and kids can get it. And the numbers were going down. And now it's projected that they're going to increase sixfold by 2029 if this doesn't somehow turn around. I mean, it's just an incredible, incredibly important project to continue to save lives that we've been doing such a great job for the last 20 years. It's the largest public health project and one that has saved more lives than any other public health project. So, and it just ended just like that. And it didn't phase out. They didn't look for any other new partners to come in to take it over. It just stopped. And now this is what is going to happen. It's so tragic. It just, I don't know. It's hard to just imagine that the United States will be looked at as, really, really cruel country. That's not what the people in this country are all about. I mean, in the way it was done was so crass. And it's life-threatening. I mean, it's just a disaster.
It's also unfortunate that just this past year, lenacapavir, whose brand name I'm forgetting, is a potentially game-changing preventative drug for HIV. And the infrastructure to, get that drug out there is going to crumble.
Yeah, lenacapavir is an injection taken twice a year. It prevents HIV. So it's made by Gilead Pharmaceuticals, big pharmaceutical company here in the United States. And I mean, it really is going to be a game changer. I don't know who's going to do it now because USAID has disappeared. PEPFAR is not there anymore or going away soon. But hopefully some other people can pick up the pieces and get the drugs back on the market and get this prevention treatment out to the people who really need it. I mean, it's just phenomenally successful drug, this new one, and just one injection, and cost of goods is really very, very minimal. So it's a doable thing.
Doable and a huge breakthrough that we're hoping and praying will go forward.
Yeah, we don't know. We've poured in billions of dollars into making a vaccine, and it hasn't worked. And now you have a medication that can be given every 6 months, and it can prevent infection like a vaccine, but it's not a vaccine. It's actually a drug. And they're working on drugs that maybe only have to be given once a year. But you got to deliver it, and you got to monitor it, and you got to, make sure everything is going okay with it. And, we'll see. But now with the US out of the business, what will happen internationally remains to be seen. But other players The one that I think will probably step to the plate are the Chinese. They have the cash. They're willing to invest in these countries. They're already doing it on the technical side, building railroads, building roads, some buildings, doing physical infrastructure. But they probably may pick up some of the slack. They're the ones with the money, and they're already in many of these countries already. And basically, I guess the United States is throwing their hands up and walking away.
Extremely unfortunate, and a story that we will have our eyes on as much as we can as news begins to come out. But on that note, unfortunately, that is our time for today. So thank you so much, Dr. Murphy, for your time and your expertise breaking this down for us and, leading us into the future with this information.
Well, thank you. And let's hope for a better week next week.
Absolutely. Thank you all for joining us this week. We hope to see you back next week. And if you have any questions, follow up, or suggested topics, please feel free to leave them down below in the comments or linked at any of our social media in the description. Happy Valentine's Day. Have a great weekend.